Hello and welcome. It's 11 a.m. here in Seoul. I'm Mi Kyung-eun at the Arirang News Center. We're breaking into our regular session to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Health Ministry official Yoon Tae-ho will be giving us an update on the COVID-19 situation here in the country. He'll fill us on the number of new infections as of midnight and the efforts that the government is making to contain the virus, especially with continuing cluster infection here in Seoul and the surrounding capital region. To give you a brief idea as we wait, South Korea reported 1,092 new cases on Wednesday, of which 1,060 were locally transmitted. That's about 200 more than yesterday. With that, the daily tally has rebounded into 1,000 range. We'll cut into the briefing now.
First of all, we have Mr. Yoon Tae-ho with the explanation on the COVID-19 response here in South Korea. Let us now begin our regular briefing for December 23rd, Wednesday. As of today midnight, we have 1,060 new local infections. And yesterday at the makeshift testing sites, we have confirmed 145 confirmed cases. And yesterday we had 17 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. The government is carrying out a massive testing right now, and we are trying to define and find our patients at an early stage. And yesterday, a total of 107,000 cases testings have been conducted, and we also are carrying out about 100,000 cases on a daily basis. And yesterday, we also had 54,000 cases with some suspective symptoms, and we also carried out about 53,000 cases of testings at the makeshift testing sites, and so far about 293,000 cases of tests have been conducted at makeshift testing sites, confirming 754 confirmed cases to date. And we are also exerting our full efforts to identify these cases at the makeshift testing sites, and we also have achieved great success with these makeshift testing sites with only 10 days in operation. However, we have 754 cases now being confirmed, and I would like to extend our deepest gratitude to the public and the medical staff for your participation. We believe that it is very important for us to stem and trace down the patients within our local communities to stem the virus, and we ask for you to get tested if you have any suspicious symptoms. And currently we have a total of 56 doctors and about 243 nurses and a total of 400 people, the medical staff members who are exerting their full efforts to contain the virus through these makeshift testing sites. And we would also like to extend our deepest gratitude to you once again for your hard efforts. And up until now, we have made great efforts to secure hospital beds, and we believe that starting from this week, we are recovering our medical capacity. And as of today, as for the people who are waiting to be administered to the hospitals, who are waiting over 1 day, has decreased significantly from 500 to about 183. And we aim to also minimize this number going forward to a double-digit number. And until that time, we will also exert our full effort to secure these hospital beds. And as for these emergency cases and patients, we will be exerting our full efforts to secure them with hospital beds in an immediate manner. And as for the high-risk patients who are residing in the nursing hospitals, in order to minimize the delay for them, we are also exerting our full efforts to secure more beds. And as for these people who need to be treated with the catalysis, we will also exert our full efforts to secure more hospital beds for these specific people. And as for these critically ill patients who are in need of emergency response needs, we will also make sure that they could be treated at regional hospitals, and we will also designate these hospital beds if needed, and we will also move these patients to other makeshift hospital beds that will be waiting in these regions respectively. And in the Seoul metropolitan city, we are also exerting our full efforts to secure more medical staff members to provide the medical care for those who have handicaps. And also we have also other detailed plans to provide detailed support. And we are securing more hospital beds without delay. And also right now for the critically ill patients, we have a total of 42 hospital beds nationwide and about 12 beds in the metropolitan area. And today we will designate an additional of 100 beds nationwide and about 52 hospital beds in the metropolitan area, and about 1/3 of them will be able to be used and utilized immediately. And from the 18th of December, we have also ordered public hospitals here in the country to designate 1% of their hospital beds to treat critically ill patients. And today we will be designating 104 additional beds. And in the by year end, we will secure about 328 additional hospital beds going forward. And in particular, Seoul's Asan Hospital has also secured enough more beds, and Yonsei Severance Hospital as well, and Samsung Medical Center has also agreed to secure 14 hospitals as well. And Kyunghee University, Inha University, and their hospitals will also secure, has already secured or have agreed to secure 100% of their capacity going forward. And as for the public hospitals, the Gangwon National University Hospital has secured 130% compared to the aim, and also the same is also applied at the Seoul National University Hospital and Chilgok as well as Gyeongbuk National Hospitals. We also have agreed to secure about 110% in ratio to these aim right now, and we would like to extend our deepest gratitude to these chiefs of these public hospitals nationwide. And we have about 7,000 or about 5,000 hospital beds to be secured in the metropolitan area, and from them we will secure 400 hospital beds immediately, and we will also designate private hospitals which is capable of treating these respiratory illnesses to designate them as special respiratory disease hospitals, and we will also provide subsidies of 14 billion Korean won going forward, and we will also provide more incentives and subsidies for personnel measures as well. And from yesterday, we have been receiving open call applications for private hospitals, and as soon as end of December, we will be administering patients to these hospitals. And we also have the emergency response team that has been self-volunteered by the Korea Medical Association, and they are already mobilized to these medical scenes. And starting from tomorrow, we will mobilize them to the designated hospital to treat respiratory diseases, and they will also engage in treating critically ill patients. And we believe that there are many people who are exerting their full efforts to treat COVID-19 patients and to save the valuable lives of our public. We extend our deepest gratitude to them once again. And we would like to provide you some update on our response measures for the new variant of COVID-19 and that has been detected in the UK. And yesterday afternoon, we have had a pan-government meeting, and here are some response measures. Starting from today until the 31st of December, we will have a temporary halt to all of the flights flying in and out of UK, and we will also have a strict quarantine of 14 days for everyone who are coming in from UK, and also after their isolation they will be tested of PCR testing once again, and we will also reduce the screening capacity, the temperature capacity for these passengers who are coming from the UK from 37.5 degrees Celsius to 37.3 Celsius, that is. And also we will be testing every of the flight attendants who are flying in from UK as well. And we believe that the Christmas holidays and the year-end holidays will also have greater foot traffic and gatherings, and this is why starting from tomorrow we have a special year-end holiday quarantine measures. And considering the grave condition here in South Korea, we are strongly recommending people refraining from gatherings of 5 or more people. And as already announced in the metropolitan area, we are already banning the gatherings of 5 or more people, and this does not mean that it is safe to have meetings with 4 people. However, even though we need to note that the lower number of attendees at certain meetings could also be very risky as well, because it is time for us to cancel or delay any gatherings. And please note that any gatherings of more than 5 people is highly and significantly dangerous. And we are also having a gathering ban on winter sports facilities as well as party rooms, and we are restricting the accommodation facilities to about 50% of their room capacity. And we understand that there could be great inconveniences who have been already reserved their bookings at these hotels and hospitality services. However, we need to ask you to comply with these measures, and they will be also revealed to the public going forward. And the Culture Ministry is also having strong monitoring of these on-site inspection for these hospitality services, and we believe that we are trying to have a halt on any travel plans that you might have during the year-end holidays. And we believe that these quarantine measures could inflict great damages to those people, especially in terms of their livelihoods. However, we will be cooperating with related ministries to provide incentives and support. And we will also intensify our quarantine measures for high-risk facilities. As for nursing hospitals, nursing homes, and mental health care centers, we will be carrying out our testings on a regular basis, and we will carry out the regular testings for every 1 week and 2 weeks respectively in the metropolitan area and non-metropolitan area as well. And we will also intensify our monitoring for these staff members who are working at these facilities. Our daily tally has rebounded to the 100,000 range, and we need to exert our full efforts to recover our medical capacity. However, we are seeing accumulated level of fatigue among medical staff members. We need to make sure that the COVID-19 outbreak here in South Korea could be overturned in the year end. We ask for your continued support, and we need to muster our strength going forward, and the government will also muster its strength going forward. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 1,092 new cases on Wednesday, of which 1,060 were locally transmitted. That's about 200 more than reported yesterday. With that, the daily tally has rebounded into the 1,000 range for the first time in 3 days, and the health authorities are expecting the trend to continue for the next few days. We'll wrap up the coverage of the briefing here. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.
can prevent it if we